HHA Practice Test 2026 Home Health Aide, Full Course Changes in Condition Reporting. Question 1. Which of the following is an objective observation? The client says they feel sick. The client's temperature is 101.2 degrees Fahrenheit. The client seems sad. The client says their head hurts. Objective data is measurable and observable, facts, while subjective is what the client tells you. Question 2. What should an HHA do first if they notice a client's breathing is very shallow and rapid? Wait for 10 minutes to see if it changes. Immediately notify the supervisor or call 911 if an emergency. Give the client a glass of water. Check the client's temperature. Respiratory distress is a critical change in condition requiring immediate reporting. Question 3. When reporting a change in condition, the HHA should include only their opinion, specific, objective facts and when the change was noticed, vague descriptions like acting weird, nothing, if they aren't sure. Effective reporting relies on specific and clear information. Question 4. A client who is usually alert becomes suddenly confused. This is normal aging. A change in condition that must be reported. A sign they need a nap. The client being difficult. Sudden confusion, delirium, can indicate infection, dehydration, or other serious issues. Question 5. Which of these skin changes should be reported immediately? A small freckle. A new red area over a bony prominence that doesn't go away. Dry skin on the elbows. A suntan. Redness over a bone can indicate the start of a pressure ulcer. Question 6. If a client who normally walks well suddenly starts stumbling, the HHA should buy them new shoes. Report the change to the supervisor. Tell them to try harder. Ignore it unless they fall. Changes in mobility or balance are significant and can lead to falls. Question 7. Which of these is a subjective observation? A rash on the arm. A blood pressure of 140/90. The client reporting I feel dizzy. A weight of 150 pounds. Subjective observations are things the client feels and reports but cannot be measured by the HHA. Question 8. An HHA notices a foul odor coming from a client's wound. They should spray air freshener. Report it to the supervisor/nurse. Cover it with more tape. Clean it with soap. Odor can indicate infection and must be assessed by a nurse. Question 9. True or false, HHAs should report any change in a client's appetite or fluid intake. True. False. Nutrition and hydration changes can impact overall health and should be documented. Question 10. What is the best way to report an urgent but non-emergency change? Wait until the next weekly meeting. Call the supervisor immediately. Leave a note on the kitchen counter. Tell the neighbor. Prompt verbal reporting is necessary for significant changes. Question 11. A client's urine is dark and has a strong smell. The HHA should assume they ate asparagus. Report it as a potential sign of dehydration or infection. Do nothing. Give them soda. Changes in urine appearance or odor are clinically significant. Question 12. Why is it important to report a client's mood changes? To gossip. Because it could indicate depression, pain, or medication side effects. To get the client in trouble. Mood doesn't matter. Psychosocial changes are just as important as physical ones. Question 13. Which of these is a late sign of a problem? Mild cough. Cyanosis, bluish skin color. A slight itch. Hunger. Cyanosis indicates serious lack of oxygen and is a late, critical sign. Question 14. If an HHA is unsure if a change is important, they should ignore it. Report it anyway to be safe. Ask a friend. Wait a few days. When in doubt, always report. It's better to report a minor change than miss a major one. Question 15. Documentation of a change should include what was observed, who it was reported to, the time of the observation, all of the above. Complete documentation covers what, when, and action taken. Question 16. A sudden increase in swelling, edema, in the legs should be reported because it can indicate heart or kidney issues. The client is getting taller. New shoes are needed. The client is sleeping too much. Edema can be a sign of fluid overload or organ failure. Question 17. Which vital sign change is most concerning? Temperature goes from 98.6 to 98.8. Pulse goes from 72 to 130 while resting. Blood pressure stays the same. Respiration is 16. A resting heart rate of 130, tachycardia, is a significant change. Question 18. If a client falls but says they are fine, the HHA should forget about it. Report the fall and follow agency incident protocols. Tell them to be more careful. Help them up and keep it a secret. All falls must be reported regardless of apparent injury. Question 19. Signs of a stroke, CVA, include facial drooping and slurred speech, a runny nose, sneezing, itchy eyes. Fast, face, arms, speech, time, is the standard for stroke recognition. Question 20. Consistent reporting helps the care team identify trends and adjust the care plan. Spend more money. Write more books. Avoid the client. Observations from the HHA are vital for maintaining and updating the plan of care.